Hello, and welcome to the Winnebago County Health Department TV show, where we talk about public health issues and relate them to your health. I'm Alana Erickson. Today I have a guest with me here from the Health Department. Go ahead and introduce yourself and your title.
My name is Carolyn McCarty, and I'm the Community Health and Prevention Supervisor at the Winnebago County Health Department.
Thanks for being here. So today we're going to talk about health improvement plans. First, can you explain what a health improvement plan is, why we need one?
Sure. So a health improvement plan is sort of kind of a guidebook, a way for people and organizations who want to impact health, a way for them to know what to work on, what are the priorities in that area, and how to do that. What are some good ways to have a good impact on that priority?
Okay, so you talk about impacting things. What are these health factors that play a role in the health plan?
Yeah, so our health is impacted by a lot of things. We've learned a lot about what impacts our health in recent years. Traditionally, we thought of health behaviors, and that if we wanted to impact health, we needed to just teach people how to do healthier things. And what we've learned is that that's important, that that's a piece of the puzzle, but it's a much smaller piece than we thought. And that things like the physical environment and social context have a big impact on our health. And that we need to work at that higher level in order to have a more sustainable impact on a larger percent of the population.
So the state of Wisconsin just released their health improvement plan. What are their major focus areas? What are they working on?
Yeah, so the state has a health improvement plan that they do every few years. And in this version that they just released about a month ago, they've identified 5 priority health areas to work on. The first of those is opioids, also tobacco, alcohol, suicide, and nutrition and physical activity.
Okay, so out of those priorities, do any of them relate to Winnebago County's health improvement plan?
Yeah, so when we saw the state health improvement plan come out, we were kind of excited to see that it aligns really well with the priorities that we've identified for our health department and for our community. So there's the state health improvement plan, and then there's also a community health improvement plan that we develop at the local level. And just recently, it hasn't totally been released yet, but we've identified the priorities for our what we call CHIP, Community Health Improvement Plan. And those include social and place connectedness, opportunities that improve health, mental health, alcohol and other drugs, and healthy foods and beverages.
Okay.
And then within the health department, we have our Community Health and Prevention Division, which is the area in which I work. And we have focus areas that we work on. And these align almost perfectly with the State Health Improvement Plan priorities. And so we work in the area of substance use, which includes alcohol and opioids and tobacco. We also work in mental health, healthy food systems and nutrition, and active communities. So you can see there's really clear alignment across these 3 pieces.
Yeah, they're very intertwined, but I'm curious, what's the difference? How did we come up with our priorities? Why didn't we just take the priorities from the state list?
Yeah, so the state identifies the big issues that go on across the state, but what we care most about are the issues impacting our local community. So our Community Health Improvement Plan, the process for developing that allows us to identify the issues that are most pertinent in our local area and how we can work on those in the ways that will impact our local people the most. And then that health improvement plan is for more than just the health department. That's for the whole community to know what can we be working on to impact health in our county. And then our health department identifies what are we specifically working on as a health department, and that's where those 4 focus areas of the Community Health and Prevention Division come in. And they're guided a lot by the CHIP, also by the state and national priorities, and then what we hear from partners and other factors like that.
All right, so it's a community conversation that really decides what's local to Winnebago County.
That's right. There's data. We use some hard numbers, some surveys and data, and then we have conversations with key community members and community partners to help identify those issues.
Good. Well, it's nice to see that this process works from the bottom up and the top down. It seems like, we made a nice mix of what the locals need and what the state wants us to be working on as the health department. Let's dive into some of the priorities and kind of give folks at home an example of what that actually looks like. So you mentioned one of the state priorities being suicide prevention. And how does that coincide with the efforts at Winnebago County?
Yeah, so suicide prevention is a priority within our areas of mental health, which is a focus of both the Community Health Improvement Plan and our Community Health and Prevention Division within the county. And another piece within the Community Health Improvement Plan that really will impact suicide prevention is the social and place connectedness piece that I mentioned.
Great. Another one we were talking about was the opioid, alcohol, and tobacco use. When we're in Winnebago County, what are we focusing on?
Yeah, so we have exciting work in each of those areas. Some of those are growing issues. Some of those are issues that we've seen for a long period of time, and we've been working hard to impact them for a while. One of the growing issues, emerging issues that we're seeing is the opioids, like you mentioned. And we have a relatively new coalition in Winnebago County called the Winnebago County Drug and Alcohol Coalition that is really where the health department is putting our energy in terms of impacting opioid use and reducing harm and death from opioid use. And that previously was called the Heroin Task Force. Just this past year changed its name to the Drug and Alcohol Coalition. So that's really where the efforts are at, and they work in prevention and awareness, treatment and recovery, communications, and data. So that's where the work for opioids is at. Our Rethink, the Winnebago County's Healthy Living Coalition, has an alcohol team that is working on changing the alcohol culture and reducing binge drinking. So they just went through a planning process, and this year focusing, this summer really, and through into the fall, focusing efforts on understanding the alcohol culture, particularly at festivals and events, and then hopefully having an impact on reducing binge drinking in those atmospheres and those sorts of things.
All right. And Leslie, let's talk about some of the nutrition and physical activity examples in Winnebago County.
Yeah, so that again is work we've been doing for a long time, but we have some new initiatives that we've been working on that are really interesting and innovative. In the nutrition and food systems work, we have a partnership with our retail outlets, our restaurants, that tries to encourage children to make healthy food choices while they're eating out. So that's called Kids Live Well, and it's part of kind of a national initiative, but we've brought it here to the local level and have been working with restaurants to have that implemented there.
Great. Well, it looks like you guys are doing a lot of work. You know, and it's obvious that the health department can't take it all on. You know, what partners are you pulling in? What's the health department's role in making sure this health improvement plan goes through?
Yeah, so we really see our role as kind of leading the strategy around this and pulling in partners and hearing from the community and initiating change through those partnerships.
Great. And when 2020 gets here, we do it all over again?
We do. We go back to the community. We learn what's new, what's going on, where we need to continue to work, and we keep pushing forward to make our community a healthier place.
Great. Well, thanks for being on. You can find more information about Winnebago County's Health Improvement Plan on our website, www.winnebagopublichealth.org, and follow our updates about how you can get engaged on our social media @Winnebago Health.